Hello and welcome everyone to our podcast. We are a group of students from University of Windsor, currently pursuing Master of Applied Computing. My name is Bhautik Patel.
I am Tirth Patel. And I am Yash Donga.
Today we are going to discuss about the topic engineering of software for medical health industries. To support our discussion, we interviewed two persons. One is Priyank Gajera, who are working as a software engineer in US since last 10 years, and another one is Dhaval Balara, who are working in medtech industries. To begin our discussion, I think we need to discuss about what kind of software currently used in medical and healthcare industry right now.
So, based on my belief, in past patients used to visit hospitals for their checkup, but in this present days, new technologies has been arrived. Like telemedicine is a new technology that is emerged in this modern era. It is also known as e-health and e-visits, and it is also used for electronics and telecommunication technology, which helps patient for the treatment on different location and also readily can share their exchange medical information. And for example, pandemic COVID-19, which was happened in the past, at that time telemedicine was massively increased, and also there are some different applications like mental health tracker and mental health record, in which users allows to check their updates, day-to-day updates about their prescription, health data and symptoms, and it's more easier for the patient and the doctors.
But there are also other applications available in market, if we consider MRI, X-ray or CT scan, they are using medical imaging software, and they are visualizing medical images and analyze the patient condition. And like similar application also medical diagnosis software, which use algorithm and data analysis process to provide recommendation medical expert. And clinical decisions support system are also available in market. It provides detailed analysis of patient medical condition. And the last one is a clinical data interchange standard consortium. It is the kind of a complex system which use a complex operation and perform some operation to develop a drug invention, which is generally used by pharmaceutical companies.
So in current scenario, not only the general application which support the task to the administrative staff of the hospital, but software is also involving in complex tasks such as providing MRI reports and help to build the drug medical the sort of things. So I have a questions like if to develop such kind of complex software, it's the process of development, it's bit different from the developing of general software such as social media or game. So what's your view on that?
In my opinion, like software engineer for healthcare and medical application follows highly regulated and structured approach. And development methodologies prefer documentation, testing and observation, and also documentation covers takes prefer through decisions or submissions for ensure patient safety and legal loyalty.
Yes, they are the same process followed by the software engineer, but here I get detailed information from the research paper. They follow all the source code review and development plan. After that, there are a validation plan. In that, they follow installation qualification, operational and performance qualification factor at the end of software organization. After that, they also perform a risk assessment part by the software engineers, and they provide this software to the organization who is working for the government or the health and medical sector, and they provide detailed validation report. And after the clean sheet, after providing clean sheet from this such organization, software organization can deploy that software in the real market. So this is what the scenario, and I get this information, detailed information from the one.
To develop such a complex software, it's required to focus more on validation and testing part as well as the risk part. Apart from this, there are any other challenges are faced by the software engineer who are going to develop such kind of software, who are especially related to medical and healthcare industries? What kind of challenges they are faced?
Yes, like yeah, medical staffs come from a diverse technical background in which it feels very difficult to understand. So the software should be designed in such a manner that medical like doctors, nurses, or any other health professionals can easily access and can use easily the application, and also it should be user friendly. One important thing is data security and privacy, which is most important in this software application. The all the person's data should be maintained in such a manner that it cannot be accessed by any unauthorized person or anonymous. So it is one of the most important role which plays in this data security. So it should be maintained in such a manner that it cannot be accessed by any other single person, and it should be accessed by a person and a doctor in between.
So here I want to add two other factors which are faced by the software engineer, like data integration challenges. And if we take example of a hospital and clinics, they are using complex systems. So there are data sources which is a different kind of data structure used by individual software. So here if we need to integrate the data from one application software to other software, so we need it's bit challenging for this process. So this is the factor followed by the challenge by the software engineer, and the other factor is regulatory compliance. In this, there are some organization working as a government organization, the medical and health related sector. They define some rules and norms to provide a better solution in terms of software. So this kind of information software engineer need to have, and they should develop the software in such manner to consider all these regulation are followed by their software.
So the diversity of medical equipment and norms which is governed by the government and authorities not it also increase the challenge to develop the software for software engineer. Apart from this, it's now time to discuss about what are the future horizon of softwares which is related to medical and healthcare center. What kind of software we can see in near futures?
So based on my research, AI powered diagnostics and treatment, in which medical machine learning algorithms have been used in such a way that it analyzes the bulk of data, and it makes easier for the doctor and patients to check their past history.
AI, VR technology are also playing an important role in this health and medical care sector. Like AR, augmented reality, are help a doctor to visualize the patient specific parts. Like if we consider heart and lungs, they can detect where there are cuts or the tumor in their parts. So it helps doctor to operate their patients, and in virtual reality are kind of things where they perform surgery at the practice for the practice, and they can train surgeons.
As per the articles and research, it also found that VR and AR are going to enter the market in medical and health sector. So the software related to AR and VR in healthcare, it's not far from the future. It's not far in future. So it's time to wrap up our discussion. We discuss about what kind of application currently in market and what we can see in near future. After that, we also discuss that what are the challenges are faced by the software engineer and what kind of process are different from developing software related to software and healthcare sector. So it was such a nice discussion. Let's thank our viewers. Let's thank our listener who listen us patiently. And at the end, thank you Priyank Gajera and Dhaval Barara who gave their expert insight in our discussion.